Hi, this is Greg, lead pastor at South Metro Vineyard Church. Thanks for tuning in for another video. One of the things as a church community that we want to do is help you stay informed with good information from reliable sources in regards to the COVID-19 virus crisis. Today we get the unique opportunity to have Dr. Frank Rhame with us. And he is an infectious disease specialist with over 45 years of experience. He was so gracious to take the time today to answer a bunch of questions that we thought was helpful. We hope that you find it helpful, that you'll share it with your friends. So please check out this video.
Thank you for joining us for this COVID-19 What You Need to Know informative video by South Metro Vineyard Church. My name is Vino Raj, and I'm one of the council members here. And with me, I have Pastor Miguel from Viña Church, and Katie, also one of the council members here. I think the main goal of this video is to bring some clarity to what exactly is this coronavirus and COVID-19, and how should we keep ourselves informed. So in this video, I want to break it into 3 segments. Just do a bit of an introduction as to what exactly this is and what it means. The second part would be, how do we stay informed? What should we do as a community? And then what should we do individually? And finally, have some time to answer some questions from within our congregation. Today, I really have the privilege of having a guest join us. Dr. Frank Rhame is a very close friend of mine and a co-worker at Allina Health. Dr. Frank Rhame is an infectious disease specialist with over, 45 years of experience?
He's actually my boss.
No. He's an epidemiologist researcher as well. He has a lot of knowledge and expertise in this. So thank you for taking the time to come here and shed some clarity and light on this situation.
Yeah, it's great to be here because I think there's a lot of information that needs to get out, and I'm very eager to help do it.
Thank you, Doc. So let's start off. Introductions. What exactly is this coronavirus? I've had people confused with names. COVID-19. There's a few other names. The nCoV. Now it's called the COVID. So what exactly is this? What is this virus? Why is this a pandemic?
So technically, COVID-19 is the illness. SARS-CoV-2 is the virus. And we have actually 7 coronaviruses that have affected humans, and there are many, many more that affect other animals. You are familiar with 2 of them, SARS and MERS, SARS-1 and MERS, and there are actually 4 of them that cause the common cold. So this one is new, and we have a pretty good idea about the broad strokes, at least, of where it came from. You need to understand the power of genetic sequencing. When you take the genes of the virus and you see what exactly the sequence is, you can find out a huge amount of information. In particular, there's a bat coronavirus that is very much has a very similar sequence to ours. So this clearly came from a bat coronavirus. We don't know if it passed through a mammal, so we know that MERS goes through camels to humans. It's a bat virus. We know that SARS went from a bat virus to civets to humans. Whether this one went through a mammal, we don't know, but it ultimately came from a bat. We know that with high level of certainty. And people who have these conspiratorial theories, that discourages me immensely because we have some important things to discuss. That just distracts stuff from what's important. Nobody is smart enough to figure this out. So, and if the Chinese did it, they didn't do a very good job of it because they suffered immensely from this virus.
Can you talk a little bit about the difference between influenza virus and the coronavirus?
So there are lots of viruses that affect humans. They have different genetic structures. They're quite variable. They have different ways of getting around. Both influenza virus and the coronaviruses for us are respiratory viruses. They cause respiratory symptoms: runny nose, sore throat, cough, pneumonia. These are respiratory tract problems. Influenza is the same way. That's the kind of stuff it can do. The norovirus causes vomiting and diarrhea. Measles virus causes rash and a systemic illness. These are all different viruses, and they all have their own way of getting around in the world. And this one gets around by droplets.
Could you help distinguish for us difference between virus and bacteria and why we fight them differently?
So bacteria actually are living creatures. If I have a jar of bacteria, they're doing something. If I have a jar of viruses, they're not doing anything. They don't do anything until they get into and take over a cell. They don't have a lot of machinery. They can't synthesize energy. They can't synthesize protein. They're just basically a gene that gets into a cell and takes it over and causes it to produce more of itself. So they're inanimate. And they're quite unlike us. That's one of the reasons it's harder to find a treatment for viruses. Bacteria are doing all kinds of things. For instance, they have hundreds of genes. Most of the viruses just have a few genes because all their job is to get into a cell and take it over.
Something that has been really confusing around is this incubation time and how that relates to quarantine. So if you could speak a little bit about incubation, recovery, and this quarantine.
So the incubation time is the interval between the time you get the virus, it first gets to you and starts multiplying you, and the time you have symptoms. Now that is an important issue in there because a lot of people don't get any symptoms. So they don't have an incubation period because they never get any symptoms. They'll make antibodies, and they can transmit, and that's a key issue for this virus, that asymptomatic people can transmit it. But it's typically 6 days or so for this virus, longer than influenza. Influenza is like 2 or 3 days. That's the fastest one we have. It can go out close to 14 days. That's why we do the quarantine for 14 days, because usually if people are going to have symptoms, they'll have them really around 6 or 7 days, but almost always by 14 days.
You make a good point about couriers and asymptomatic people being couriers.
Yeah.
So who can be a courier, and can a recovered person be a courier?
So carrier is a word I need to think about a little bit here, because we typically reserve carriers, the carrier state, for people who are long-term carriers. So HIV causes a carrier state. Hepatitis B, hepatitis C, they can cause a long-term carrier state. They go on for years, those things, unless you intervene. So we believe that most people are going to have it for 14 days and then they won't have it anymore. That's obviously an oversimplification, because we've seen some people who can persist with test positivity for longer than 14 days, but most people have a symptomatic period which doesn't go out more than a week or two, and may have a positive test for a week or two after that, but then it's gone. It never comes back as far as we know. We don't have any evidence yet for second infections, which is a terribly important question as far as vaccine is concerned, because if people get second infections readily, then a vaccine is not going to work.
I think that's a really good segue to move on to our next segment, is how do we stay informed? I think one of the biggest things is we're getting so much of information.
Yeah.
It's confusing people, it's raising panic. You really don't know where to go for your proper information. So how about if you could touch a little bit on what are the benefits of this, the data that is being spread, and where do we really go for good information?
So the two best places are the Minnesota Department of Health website. If you just type in MDH and then coronavirus or COVID or SARS-2, that you'll get to that webpage, and it has a wealth of information. CDC has a wealth of information as well on it. So those would be the two places I would go to.
We had more questions about the testing. Do you have any thoughts or information to give us regarding when you believe it will be available, to whom, and how will people be prioritized?
Well, so it's available now. It's just not available in enough volume. We have made we've not done well in this. In our country, has not responded well in that regard. We've done probably a total of 10 or 20,000 tests. South Korea does 10,000 tests a day. They work very hard to find people who have it, and that goes back to the asymptomatic issue. Unless you're doing a lot of tests, you're not going to find the asymptomatic people. So they test people who had exposure and feel well, and they test people who have respiratory symptoms, and they get them in quarantine. And that's how South Korea has actually brought its outbreak under control. we just don't have enough tests. We did not anticipate this very well. And I'm sure in a week or two it's going to be vastly different. But right now, we just don't have enough tests. I mean, as far as I'm concerned, we should be testing everybody with respiratory symptoms and everybody who's been exposed to someone. We can't even come close to that right now. So what we should do and what we have to do, because we have to conserve the resources we have, are vastly different things.
Can you be tested too early? Do we need to wait a period of time?
Great question. I wish I knew the answer to that question. So I just said we should test exposed people, and that's we're not near the capability to do that. Should you test them the day after the exposure? Should you test them the day after the exposure and then 4 days later? Those things are not known. We haven't had sequential testing of people just after an exposure enough to really know when they turn positive. I wish I knew the answer to that question, because then you could say, all right, test everybody who's exposed on the 3rd day after exposure. Don't have that information.
Something that we all know, it's a pandemic, and there's so much of information. Can you talk about a little bit of like some of the key informations or the key metrics that we should be looking for?
Well, I think it is really important to know that this virus can really hammer us. If you look at what happened in Iran, if you look what happened in Wuhan, if you look what's happening now in Italy, they're at 1,000 deaths after in a week or two, and they've shut their whole society down. So this virus can really hammer us, and anybody who says it's a hoax or downplays it, that's just crazy. Now, I hope that's not going to happen. If we react in as disciplined enough fashion, if we do indeed quarantine ourselves and don't spread it amongst ourselves, then we'll be at the safe end of that spectrum. But if we don't do that, it's going to crush us. It's going to crush hospitals. So that's that flattening of the curve issue, which as a hospital person is utterly crucial. So for instance, the United States has around 95,000 ICU beds, and actually only 5% of them are empty today. If let's say 10 or 20% of Americans are going to get infected by this virus in the next year, if it happens all at once, that could be as many as 600,000 people needing an ICU bed. We just can't manage that. And that just doesn't threaten people with COVID. It threatens everybody, because that's going to displace people from ICU beds who need it for other stuff. Now, I know that our hospital systems are working very hard and very inventively to find ways of meeting that extra capacity, but 600,000 patients we cannot manage. It will be a disaster. So that's what flattening the curve is about. That's about delaying the infections so that they don't come all at once. They come gradually. That's bad enough, because a lot of people are going to die, and a lot of people are going to get sick if we get 10% or 20% of Americans infected. But at least the hospitals will be able to deal with it.
And I think that's a great. My next question surrounds that. How can we be responsible as a community? What is this social distancing? How does that help with this, what you just talked about?
So every transmission prevented or delayed flattens that curve or lowers it. So I think that we can do more than just flatten the curve. I think we can reduce the total number of Americans from 20% to 10%, or from 40% to 20%. So I think we can not only stretch it out over time, but we can reduce the total number of people. But that means just staying away from people. If we could shut down, well, we have to shut down normal life for a month or two. If we get everybody separated from everybody else, even for 14 days, you stop the virus. But you can't do that. So it's going to tail out. But if the more we can get people from not transmitting to each other, the better it will be in terms of this. And since asymptomatic people can transmit, we really need to just stay away from each other.
Let's talk about individuals. Would you, as medical professionals, we really want individuals to have the proper information.
Yeah.
What would be some of these medical advice that we can give individuals to practice, per se?
So I think the question of how do you socially distance is interesting. We should be farther apart than we are right now. We really should. I mean, so I went around the clinic the other day. We should be 6 feet is what they say. It's actually 2 meters, but Americans don't know about meters. So I got a tape measure out that was 2 meters long, and I said, hold that to your nose, and I'll hold it to my nose. And most people are surprised at how far away you have to be 2 meters away from each other. So we've taken our clinic, in our waiting room in our clinic, for instance, we've taken chairs out so that every chair in our clinic is now 6 feet away from every other chair. We have a line drawn in front of the office, the desk where the people meet the patients, and so we have a sign that says, please stay behind this line as much as you can, so that the people coming to the clinic are more than 2 meters away from the people. They have to be there to work the computers, but the patients need to stay 2 meters away. So we are doing everything we can to keep people 2 meters away, and we're postponing all elective appointments. And when people have respiratory symptoms, we try to figure out exactly what level of illness they have. If it's a minor illness, we just want them to stay home. Someday we'll be testing them, but right now we don't have to test them. So the triage nurse has got, when you call, you get the triage nurse. The triage nurse has got a set of questions to ask. And if you have really minor illness and you don't have comorbidities, maybe that's what we'll talk about that in a second, then we want you to stay at home and stay, above all, stay away from work, stay away from people if you actually have respiratory symptoms. Because it might be COVID. Probably right now it'd be influenza, but it could be COVID. And so, over the next month, it's going to be, that ratio is going to shift because influenza is going to be going away and COVID is going to be getting higher. If you have comorbidities and you have 105 fever and you're short of breath, we want you to go to the hospital emergency room, so we have these levels, and it's a subtle and complicated business, and it changes according to what our resources are.
That's actually one of the questions from the community question side. So why don't you elaborate a little bit more on when should I actually go to the hospital? When am I really sick? Is it?
So you should not go to the hospital until you've called the triage nurse and found out what she or he assesses the severity of your illness. Do not start by going to the hospital or the clinic. Start by calling the nurse and figuring out where you are in this hierarchy of need. And they will ask not only questions about what your current illness is, but they'll ask about these comorbidities. So we know that the death rate of this illness is vastly different depending on your setting. Kids practically never die from this virus. People my age, people over 80, I'm not quite 80, but die like in Wuhan, they were dying at like 15% of them died. That's a big hit. That's why we want to work very hard to protect people in nursing homes. The biggest nightmare in the world is what's going on in Seattle, where the virus got into a nursing home with lots of people who were that old. They had like 15 deaths. So you really, really want to protect old people. And it's also people who have lung disease, other chronic, particularly lung disease, but after that, obesity, chronic renal failure, immunosuppression from HIV or a transplant or any of that sort of stuff. We want to protect those people above all. So that hierarchy of hazard is very important in trying to figure out whom you especially want to social distance. So don't go visit Granny until this is over.
Let's touch a little bit about that topic.
I wanted to say someone just called me and told me that she feels that she has some symptoms and she doesn't know what to do. She said based on the priorities that they're giving people to be tested, I don't qualify. What do you recommend? Like maybe I think her husband had influenza about 2 weeks ago, and it might be that. But should you think she should be taking just the regular stuff like for flu and things like that?
So if her husband had influenza, she's lucky because that means this is probably influenza. But if it was out of the blue, or if she worked in a hotel front desk that had a lot of international visits and had no exposure to anything else, then it's more likely to be COVID. But what you do is to call that triage nurse, and that triage nurse will ask you questions about your symptoms and your comorbidities, and will tell you to just stay home. I'm sorry, we can't test you. I mean, in the ideal world, there'd be a test, but we don't have that ideal world right now as far as testing is concerned. So it's really saddening, but that's the right thing to do now, is to go there. In the ideal world, she'd go to one of these drive-by testing sites and get a test. But you can't do that today because we just don't have the resources to do that.
One of the biggest questions I have got is, what happens if someone in my family tests positive? What do I do?
So that's a very difficult issue because it is very hard to maintain distance, the adequate distance, when the two people are living in the same household. So you have to try to do that. You have to, I mean, even to the point of drawing an imaginary line in the middle of the apartment. You use the front door, your partner uses the back door, and you go right to your bed or your desk and nowhere else, and your partner makes the meal and puts it down there, and you come up and pick it up and go over there. So these are not easy things.
Does everybody quarantine in their situation? Like a family member, I don't have it, but my family member has it. Do I go out to work, or do I have to stay indoors too?
So we don't want you to work at all. We want you to stay at home. We do not want people leaving their houses unless they absolutely have to. You need to hunker down. We need to be disciplined on this. And that's going to make the difference between whether we manage to control this or not. If you look at places like Taiwan and Korea and Singapore and Hong Kong, they are managing to control this. China managed to control this. Whether Americans can have that level of discipline is uncertain right now. They do things that we Americans wouldn't permit. If you go into quarantine in Taiwan, you have to turn over the location of your cell phone to the quarantine police. They call it. If you don't, they know where it is now because you've turned over the location. If you don't answer it, they fine you. If you're in quarantine, they can fine you up to $3,600. If you're in isolation, they can fine you up to $36,000. Then they make the difference between quarantine and isolation. Quarantine is when you've been exposed and you're supposed to segregate yourself. Isolation is when you have the illness and you have to segregate yourself. So it's much more important to get the people who have the illness to segregate themselves than it's people who have the exposure, because most of them won't have it, but enough will that you want to keep them out of circulation. You think Americans would allow themselves to be required to turn their cell phone location over to the government? No. We may not have the discipline to do this like they are. Yeah.
So moving into some of these community questions. Katie, do you want to start off with the...
You've addressed the comorbidity with medical issues. Are there any other vulnerable populations, for example, someone who has a disability who might not even understand, or children too, really hard to grasp the...
So I'm glad you introduced the children, because that's a lot of special issues around that. But it is true, if you have cerebral palsy, for instance, so you can't breathe very well, or amyotrophic lateral sclerosis, your immune system is fine, but you can't defend yourself against a pulmonary infection as well. You know, cough as well, especially. Kids are a special issue here, because I think parents need to figure out how they're going to talk to children about this illness. They know something weird is going on because they're out of school, and they know it's scary because people are scared. So you have to make them. You have to be honest. You have to tell them there's a problem, and you have to do it in a way that doesn't frighten them too much. You can say that you're not at risk, because kids don't even imagine they're at risk anyway. But even if you say it's old people that are going to die, then they get worried about Granny. You know, they don't want to lose Granny, so how to balance that out with kids is extremely difficult, and what to do with them when they're home from school is equally complex. The reason you may notice the health department has agonized more over school closure than anything else, because it's not clear that closure is going to help things. China closes schools, and you know, but even they are not sure it made a difference, because it doesn't look like kids are as big a contributor to transmission as not. But what are you going to do with them? So this could go on for a month or two, or even longer. And China started shut down Wuhan on January 23rd. It's still shut down, so this could go on for a while. So kids are going to go crazy if you make them stay at home for a month or two. So what are you going to do with them? You can't send them to a daycare center with 10 other kids or 20 other kids. I think we need to address this play date issue, and there's no official guidance on this, but I think what you want to do there is parents should find a cohort. So this cohorting issue is a key to it. So you find the kid's best two friends, and you talk to those parents and you say, okay, we're going to have play dates with just our 3 kids. You don't have your kids go see anybody else. I won't have our kids go see anybody else. So they'll at least be able to play with each other, and they won't. So if it gets to be a network, so if A and B are playing, and then B and C are playing, and then C and D are playing, and D and E are playing, then it's going to spread through the whole network, because sooner or later you're going to find somebody that's got it. But if you say, all right, you're going to play with Janie and Joey only for the next month, and you can't take them to the playground either, so you got to walk in the park or stay at home. So actually, how you accomplish social distancing is full of issues like that. How you actually do it, but it's terribly important that we do it. It's terribly important we have the discipline to do it, because we do face a potential crisis. Whether it'll happen or not, I don't know, but it's likely enough that we need to react strongly.
Another one that I've heard, like lots of people actually ask me about this, is with the change of temperature, would this change on how things are spreading?
I hope. No one knows. So we're all susceptible, and that's a downside. It's pretty infectious. It isn't actually all that clear why influenza is so seasonal, but it is, and they get around the same way. So we can hope. That doesn't protect us necessarily, because influenza comes back. If you remember the Spanish influenza outbreak of 1919, it stopped in the summer, but it roared back in the summer, and the second year was actually worse than the first year. And 50 million people died from that. So I hope the heck we don't get that bad with this one, but it could be number 2 after that.
In that vein, can you address anything with regard to progress with vaccines or treatments?
So vaccine is our only hope, really. I think this will be circulating in humans until we get wide distribution of an effective vaccine. And there are lots of vaccines that are being rushed into study. Nobody thinks that we can get one ready in less than a year. And having a vaccine ready, now you got to ramp it up and give it to the world. So that's another year. And vaccines don't always work. Our influenza vaccine it's better than nothing, and it saves lives, tens of thousands of American lives. But it's only about 50% effective. HIV, we don't seem to be able to make a vaccine to HIV. Measles vaccine is great. If you get 95% of people infected or inoculated against measles, it disappears. It's only the wacko anti-vaxxers that undermine that. So we have great vaccines. So I'm just saying, it might not be possible. It's a year to wait for vaccine if we're lucky.
In that vein, possible treatments until we have the vaccines widely available?
So there's one very promising treatment, remdesivir, and there are a bunch of other things that are being considered and being tried. I went on the trials get registered on the U.S. government clinicaltrials.gov. It's a place where treatment trials are registered. There were 95 of COVID treatment trials already. Trials registered in clinicaltrials.gov for COVID. So people are really working hard on this. And I think remdesivir may work. Now, remdesivir, if it works, for instance, will help us a lot with sick people, but it doesn't stop the problem.
Is there a time frame, different time frames between these possible solutions or treatments?
So remdesivir will be studied quickly because this is you either die or you get well in 2 or 3 weeks. So so the worst patients will be in an ICU on a ventilator for a week or 2 or maybe 3, or they'll get better or they'll be dead. So you find out whether it works fast, and there are a lot of cases in China. The big randomized trial underway in China, and there are 2 important randomized trials underway in the United States. China will get the answer first because they've got thousands of patients, but when you find out the answer to that one quickly, because and so when you do a trial about whether there's a heart attack or not, you have to argue about whether the heart attack was present, and that's not always easy. With this one, you're either dead or you're alive. It's not going to be hard to sort out the outcomes.
And if the efficacy proves to be quite promising, how quickly can these be produced and distributed?
So that drug is in the hands of a company called Gilead Sciences, which is a very effective company. They will have it. They will have it. Yes, that's the only stock that's going up.
No, thank you, Doc. And with time, I wanted to just do a quick rapid fire round. These are statements that I've heard floating around. So this is myth or fact? So, Katie.
Drinking alcohol kills the virus.
Well, so the hand rubs have about 70% ethanol in them. So a really strong vodka is about 50% alcohol. Most of it's around 40% alcohol. 80 proof is 40%. So that's not enough alcohol to be an effective hand wash, and killing the virus in your mouth is not really the issue. It's your nose and your eyes that are the bigger problem.
How about gargling with salt water?
No reason to think that would work.
Face masks will protect us.
So I think that's true. I think this is droplet spread. And I think that when we see patients that have respiratory symptoms now, we go in with a mask and a face shield. That protects our eyes and our nose. The mask protects our nose and our mouth, and the face shield protects our eyes. I think that's going to be pretty effective at preventing transfers. We put a standard surgical mask on the patient, which makes it harder for that patient to spew out droplets, and we put those things on that keep the droplets from getting to us. So I think maybe surfaces play something of a role. I think probably it's more hot droplets that play a role, but we do disinfect the room substantially afterwards. People spraying disinfectant on the streets of Rome, that's silly. But people have to do something, they put on a hazmat suit and spray disinfectant on the streets. So the door handle and the computer keyboard and the desk where you put your hands after you've scratched your eyes, that's important. So one other thing I should mention that you can do is stop touching your face. I need a dog collar to keep me from scratching my face, because that's what you do. You touch that. You may have noticed that I have not touched anything here except that. I haven't touched the table. I haven't touched anything here. And that's important, and I'm trying very hard not to touch my face, which isn't altogether easy to do.
Spraying chlorine or alcohol on your skin.
So skin is not a portal of entry. So your hands, that's what's conveying these recently expelled droplets around. So he talks, and little droplets are coming out of his mouth when he talks. Yeah. And they fall to the ground in a meter or two. That's what accounts for this distancing thing. So if you've seen pictures of it, I'm doing that, and they're falling to the earth. If they fall on that, and I touch it, or he touches it, and then touches his face, that can do it. But I think mostly it's hot droplets directly from the expeller to the thing. So this is like a war of attrition in a way. You can't prevent everything. So the parent says, I'm going to keep my kid in the house and not let that kid out forever. These are crazy making if you do that. You have to accept some level of risk or you don't get crazy. So I don't think it's going to come from my droplet to his pants to his thing. It'd be the solid surface. So you can make yourself crazy on this, but if you prevent 95% of the transmissions that would have occurred, we'll win this.
You've addressed computer. There are many things we touch even more than our face, our cell phones, our remotes, the things that are feeling like lifelines right now. Do you have suggestions with regard to those?
Well, that allows me to make a point that if we hunker down, as Fauci has said we should, and as I believe we should be staying at home to the maximum extent possible. We need to develop our social networks to not go crazy, and particularly if you're put in quarantine. I mean, I can go out and buy groceries tomorrow morning. I'm going to do it at 5 o'clock in the morning to be doing it off hours, so so there'll be fewer people around. But at least I can do that. If you're in isolation, you're not supposed to leave at all, and so you need to have social networks developed so you don't go crazy when you're in that situation.
Hair dryers killing the virus? I hate to even ask that.
I think desiccation is probably does destroy the virus. It's not that wouldn't be the way I would do it. I'd get an antiseptic wipe instead of doing my hair dryer or anything. I think.
You referred to hot droplets. Is there a period of time within which you feel they would no longer be hot or able to convey it?
So that's where you get into the crazy making game. If you put virus out on a surface like that, and let's say you put it out, you centrifuge it down so there's a lot of virus per drop, and you keep it humid and you keep the temperature right, you can recover viable viruses from that for a day or two. But that's not what happens in nature. A standard droplet from me probably has a couple of viruses in it, and so they're going to die pretty quickly. So I think that almost all these transmissions are going to be, I shouldn't call it hot, that's a little bit fresh. How about that? Fresh droplets. That's where the issue is.
No, thank you so much, Doc. Thank you for taking the time. We really appreciate it. And again, the goal of this is so that we want to encourage people not to panic, but be vigilant and take measures that are needed to be taken. And we want to spread this information. So thank you for joining us, and God bless you.
Good. Thank you.